Good morning. My name is Kesari Naidu and I'm one of the exercise supervisors in the Toronto Rehab's Cardiac Program. Today, as part of your orientation session, we're going to be going through the nuts and bolts of the program and really give you an introduction to what to expect over the next 6 months to maybe even a year while you're on the program. So by the end of today's session, you will really come to know and understand how the Cardiac Rehabilitation Program works. We want you to be able to understand your particular exercise prescription individually for yourself. We're going to give you the tools to know how to exercise safely. And by the time you get into the exercise program, we want you to learn how to take your pulse accurately. So we're going to teach you how to do that today. You're also going to be able to have the opportunity to meet your cardiac rehabilitation team and see specifically who you're going to be working with while you're on the program. The purpose of the program here at Toronto Rehab, there's many purposes to the program. Often when we talk to patients and ask them why are they here, often they tell us, well, my doctor sent me here, or I really want to decrease my risk of heart disease and having another event. Sometimes they say, I'm not really sure why I'm here, and all of these reasons really are okay. Once you start into the program and really get to know what we're all about, you'll develop the reasons why you're here, and you'll eventually start to develop even some goals that you want to achieve while you're on the program. So the purpose of the program here that we've laid out to you may be applicable to you, but you might have some other reasons as well. We certainly want to help you adopt and maintain heart-healthy habits. We want you to provide you with the essential information on the benefits of cardiac rehabilitation. So not only increasing your cardiovascular fitness, your fitness level, your energy levels, we also want to provide you with essential information on risk factors associated with heart disease. So we're going to give you information around cholesterol, blood pressure, weight loss, diabetes. We also want to give you and provide you with safe guidelines for exercise. So we're going to tailor your exercise prescription for you. While you're on the program, you're going to meet an awful lot of people throughout the building, and they're really your rehabilitation team. Your rehab really started when your physician, your cardiologist, your family doctor sent you to the program by a referral. It was sent to our program, and our support staff in the admin office processed that referral. They contacted you, booked your appointments, and here you are now. You've already met our Cardiopulmonary Assessment team in the lab, and on your first visit here, you were tested, and we got some body measurements. We were able to test you in our lab and determine what your cardiovascular fitness is. Now you're going to be moving on to meeting the rest of our team, and that is meeting your cardiac rehabilitation supervisor. Your rehab supervisor is really your case manager while you're here on the program. They're here to guide your rehab and to work with you and facilitate the needs that you have while you're on the program. They're your first contact for any problems, any questions, and they're going to be progressing your exercise prescription as well. You'll also be meeting our exercise leaders on the track. They will be also working with you on the track to help as part of the team in order to carry out your exercise prescription, teach you how to take your pulse, make sure you're on pace, talk to you about your goals. And we work with our exercise leaders on the track as a team and work with you. Our program physicians here at the program, you've met some of them when you were in our lab, and also you'll be seeing them maybe on the track if you have any questions. They'll be doing some of our education sessions as well. Later on, you will have the opportunity to meet our dietitian, our social worker, and our psychologist. These are people, part of our team, that really help to give you more detailed information around some of the issues you may want to work on. As you start developing the goals that you want to achieve on the program, we may be filtering you into accessing these services so that you can achieve those goals. We have our program manager here at the program, as well as our medical director and our executive director, and you may be meeting them as well throughout the program. As you can see, you are the patient in the middle of all of the team, and you are actually part of our team, so you're very important in your whole rehab process. In terms of how long the program is here, it's about approximately 6 months to a year, depending on why you're here. Sometimes you will have weekly classes as well as monthly classes, and your exercise supervisor and your case manager will discuss that with you on an individual basis. When you come for your exercise class, you can expect to be here for about 90 minutes in length. Your class will encompass both education sessions as well as your exercise. So the education sessions will probably be anywhere between 20 minutes to about 30 minutes. Some education sessions will take in the entire exercise class, but for the most part you will have the opportunity to carry out your exercise prescription while you're here on the program. We do have some program expectations while you're coming to the center, and the only way that the program works and you gain success is through what we call consistent regular attendance. You do have a weekly appointment with us, and we do expect that you're here every week. If you are unable to make appointments as things come up, like vacation, medical appointments, other commitments, that's fine and we understand that. But please let us know if you're unable to attend. Just give us a call. You will be getting our phone number, and you can leave us a message or call the center and leave a message with us. Another expectation is the completion of exercise diaries. These particular exercise diaries are a real key communication tool between us and yourself. We see you once a week here at the center, and in order for us to know what is going on with your exercise at home, we ask you to fill out these exercise diaries. It allows us to get information around how many times a week you're exercising, what your heart rates are, what your symptoms you may be having, if any, and how you're feeling with respect to your exercise. It also allows us to know whether or not you've seen any, gone for any blood work, lab tests, or if you've seen your physicians. We'll talk later a little bit more about that exercise diary. We ask that you keep your cardiac rehab supervisor informed and up to date with all medical changes that occur with you. This includes medication changes, symptoms that may be coming on that you're not sure of, and it can be in relation to any part of your health. So please keep us informed of that. Already, before you even got here today, you've already been through our cardiopulmonary assessment. And your cardiopulmonary assessment, or another word for it that you may be familiar with is a stress test, is done initially, so you've already had your first one. And then we do follow-up assessments at your 6-month mark before you get discharged from our program. This allows us to see improvements, some functional, objective improvements in your fitness level and body measurements. We ask that when you do come to the center that you bring your OHIP card with you for each assessment when you come for your cardiopulmonary assessment. You don't have to bring your OHIP card with you every week for your exercise class. Reports from these particular assessments will be sent to all physicians that are listed on your file. This includes your referring physician as well as your family doctor if you wish. If you do have an appointment in our lab, we do ask you if you can give us a 24-hour notice for any test cancellations. We want to make sure that we can fill that particular spot if you're unable to make it. So just keep us informed if you're not able to make the appointment. What we want to move on to talking about now is really about your exercise prescription. And I want you to think about your exercise prescription as very similar to a medication prescription that your doctor sends you for. In order to treat, let's say, blood pressure, your doctor may be giving you a particular drug at a particular dosage a certain amount of times a week. Your exercise acts very similarly to that. We're going to be giving you a particular dose of exercise and ask you to complete it a certain amount of time a week. If we go back to our medication example, your doctor is going to give you a particular dosage of that medication in hopes to control and get good results on your blood pressure. If your doctor gives you too much medication, you're not going to feel all that well, and we may get your blood pressure too low. If your doctor gives you too little blood pressure medication, maybe we won't be getting optimal blood pressures, and your blood pressure may be too high. So it's a matter of getting the right dosage of that medication to get the actual best results from it. And again, your exercise results in the same thing. If we give you too much exercise or too intense exercise, then we may end up not getting the best results. You may not feel well, you may get some symptoms, and you may not increase your cardiovascular fitness. If we give you too little exercise, we may not get results either. We may just be status quo. We may not get some positive results in your cardiovascular fitness. So sticking to your exercise prescription is really important. Here at the center, when you come for your cardiopulmonary assessment, we use that information to analyze where you currently are and develop a certain speed and a training heart rate for you to work at, and ask you to exercise a certain amount of times a week. We use what's called the FITT principle, and that's an acronym that we're going to go through right now to determine and give you information around what important components should be part of your aerobic exercise prescription. And when we talk about aerobic exercise, we mean things like walking, cycling, whole body type activities that you're going to do over a period of time. So the first part of the FITT principle is the F, which is frequency of exercise. Ultimately, we want you to be working up to exercising 5 times per week. And evidence and literature has shown us that this is the optimal amount of times per week for your aerobic training to get the best results. So you're going to be exercising here once a week, and we're going to be asking you to include 4 other times while you're at home. With respect to the I of the FITT principle, this is the intensity of exercise. And the intensity of exercise is sometimes challenging to determine where really you should be working. And that's part of our job to tell you what the best pace of walking would be. So we will give you a prescribed walking speed, or if your exercise prescription is going to be on a stationary bike, we'll give you a cycling speed to work at. We'll also be giving you a training heart rate to work at. So we'll make sure that we're going to teach you how to take your pulse and try to get your heart rate into a certain level during your exercise. We also use what's called the rating of perceived exertion scale, and we're going to come back to talking about that in a moment. But this is a scale that allows you to determine subjectively for you how you feel during the exercise, and we'll talk about a little bit more about that scale when we talk about our exercise diary. The first T of the FITT principle is type of exercise. So your type of exercise is really, in the aerobic training, whole body type of activity. So things like walking, stationary cycling, a walk-jog prescription perhaps later on as we progress you through the program, and elliptical machines. If you have a membership at a gym, an elliptical machine might be something that you'd be interested in doing. Different types of activities for various reasons, for interest, for variety, those types of things. But predominantly, initially, we'll be starting you on a walking program. If there are reasons that you cannot walk, or if you have some arthritis or knee problems, hip problems that you have a difficulty walking, then we'll give you another mode like stationary cycling instead. The last T of the FITT principle is time. What is really the goal eventually to work up to with respect to your exercise for aerobic training is a goal of 30 to 60 minutes. Some of you are already there and maybe already doing 30 to 45 minutes of activity already, and that's great. Some of you may have not even tried exercise, and this is the first time, so we don't expect you to be at 30 or 60 minutes. Some of you may only be able to tolerate 10 to 15 minutes. So this is where the exercise prescription will be tailored towards you. Another part of your exercise prescription is resistance training. And resistance training is basically lifting handheld weights. And resistance training is very important for your exercise prescription to increase muscular strength, so how much strength you have in your muscles, and endurance. This particular type of program will be included in your exercise prescription probably in a couple of months. So if you're already engaged in this type of activity or you have questions around this initially, please talk to your exercise supervisor first before you proceed with those particular activities. There are many benefits to resistance training and will help with increasing your cardiovascular fitness as well as making positive changes in your body composition. So we will be looking at that a little bit later on in your program. Remember that your exercise prescription, both your resistance training and your aerobic training, is all based on your medical history, your current level of fitness, the results of your cardiopulmonary assessment, and your specific goals. So your case manager will work on looking at all of these things, as well as talking to you individually about what maybe your goals and interests are, and they will tailor and develop that exercise prescription to fit your needs. We do ask that your exercise prescription is not to be exceeded. So if we give you, let's say, a prescription of 2 miles in 40 minutes, we would like you to stick to that particular prescription. As we talked about before, if you strive ahead too early, you may get some negative results or have some symptoms. And if you don't do enough, we may not be able to get those success and results. So if you do have questions about your exercise prescription and you want to move forward, please talk to us first. We'll be more than happy to sit down and discuss our rationale for giving you that particular exercise prescription. Be prepared that your exercise prescription will be progressed by your cardiac rehab supervisor throughout the program. So your program will probably be changing every couple of weeks, every 3 weeks, depending on your progress and on your goals. A couple of things about exercise safety. One of the biggest things we want to make sure you understand first, before you head out to your exercise, is the importance of warming up and cooling down. Remember that before you do your actual workout of your exercise, you want to do at least 5 minutes of slow walking or cycling, depending on what type of exercise you're doing, before you head out. Think about your exercise or your workout as the middle portion, good chunk, good stuff of your exercise prescription. It needs to be bookended by a warm-up and a cool-down. So that warm-up is to really slowly bring the heart rate, blood pressure, and all the working muscles getting used to activity. And you need to slowly increase that circulation of blood to the working muscles before you get into your actual speed of walking. The same thing is with your cool-down. We don't want you just ending your exercise prescription and sitting down and relaxing. We want to bring that heart rate, that blood pressure, all of those good hormones going throughout your body, bringing it down to resting levels. And often, if you don't, you may feel some symptoms like lightheadedness. You may feel blood is maybe pooling in your legs, and that may be feeling uncomfortable. So it's the same thing as your warm-up. It's simply walking or stationary cycling, if that's what you're doing, for at least 5 minutes at the end of your program. We'll be going into more detail about your warm-up and your cool-down a little bit later in your program, and giving you some more physiologic explanations of why it's important as well. But please make sure that you do include both these things in your exercise prescription. Some more exercise safety tips that we want you to be aware of. One is exercise-related symptoms. If you experience anything like chest pain, palpitations, lightheadedness, any symptoms that you feel unwell, you need to stop your exercise prescription, slow down, and rest. If these are occurring, you also need to let us know, the staff know about it. If you're at home doing these activities, give us a call and let us know, and we can adjust your exercise prescription or give you some tips as to whether or not you need some more follow-up. Eating and exercise. We certainly don't want you exercising on a full stomach, so try to avoid heavy meals before you go out to do your activity. If we try to avoid we want to make sure that the blood circulating around your body is for your exercising muscles. And if you eat a heavy meal prior to that, the blood is going to be circulating into your gut to digest the food. So we want to make sure that you're not going to run into any problems. We do, however, want to make sure that you do have some fuel in your system when you're exercising, and that you're not overly too hungry and you have enough energy. So make sure that you have maybe a very light snack, maybe about an hour or so before your activity. If you are living with diabetes, we do recommend that you carry a fast-acting carbohydrate with you in case you run into problems or have any low blood sugars during your activity. We're going to be talking more about exercise and diabetes a little bit later in the program, and give you some more specific information about that. Please avoid alcohol before you exercise. Alcohol can change your judgment with respect to your exercise, so we want to make sure that you're hydrated well, and alcohol is not going to give you the proper results that you want with your exercise. So if you're wanting to have your glass of wine with dinner, maybe do your exercise first, and you can have that later. Exercising when sick. This is very important. Some people are very committed to their exercise program and really want to not miss a day. But we do advise that if you are sick with a cold or a flu or not feeling well, not to exercise. Give yourself a break. If you do have a cold or a flu or a fever, we ask that you take a break from your exercise and not return to it until you're feeling 100% better. And when you do return to your activity, we ask that you start slowly. So cutting back your prescription to maybe half the distance and maybe a little bit slower on your pace. If you are on antibiotics when you're exercising, if you're sick, we ask that you definitely not exercise and give us a call and let us know so that we can give you the proper information on how to resume your exercise. Clothing, specifically depending on the weather, clothing becomes an important factor to take into account. In general, we want you to be wearing loose, comfortable clothing that breathes well. We don't want anything constricting blood flow, a belt or tight jeans or any of that, those types of clothing. In hot weather, we want you to wear light colored clothing and loose and comfortable. In cold weather, if you're going to be exercising outdoors, layers is very important, but we will be going into more specific information around exercising in cold weather and the safety of that if you decide to exercise outdoors. We will also be giving you more information about exercising in hot weather and whether it is safe to be out there with the high heat and humidity. We want to make sure that your exercise is actually taking place on a flat surface, and this is with respect to your walking, and calm weather conditions. Things like wind and cold, sun, those types of things can play a factor into your exercise and can actually increase the intensity of your exercise as well. So please make sure that the weather conditions and the surface are flat. If you're running into problems with respect to looking for a proper route, talk to us about it and we will give you lots of suggestions with respect to a venue for your exercise. We're going to move on to talking about other types of activities or recreational activities. Often people come into the program and they're wanting to get back to certain types of activities, and as you can see here, things like skiing, cross-country skiing, downhill skiing, outdoor cycling, tennis, golfing. In the wintertime there's some other things like curling, all types of activities that you've probably maybe done in the past and want to get back to doing, or have some new interests and want to start as a novice player. We ask that right now you first just talk to us about it and let us know if you're interested in some of these things throughout your program. But to hold off on engaging in any of these activities before talking to us. We want to make sure that you're fit to do these particular activities, and we want to make sure that we get a lot of information about who you're doing these activities with, where you're doing them, how often you're doing them. We want to give you the tools and make sure that you are at the right fitness level to be able to engage in them. So talk to your exercise supervisor first and let us know. It may be not the right time to engage in the activity, but maybe further down the road, in 6 months from now, in 3 months from now, we'll be able to say yes to those particular activities. But it's important for us to be aware of it so we can work towards those goals with you. Now we're going to be talking about pulse taking. As I mentioned before, we're going to be asking you to take your pulse before your exercise and at the end of your exercise to determine if we've gotten you into a proper training range for the activity. Heart rate is the same as pulse rate, and taking your pulse accurately is really important. We don't expect everybody to get it right away. It does take lots of practice, and finding it is the first thing, as well as making sure you're timing yourself when you're taking it is also another challenge. We're going to be asking you to record your pulse on your exercise diary over a 10-second heart rate count, pre-exercise and post-exercise. We're not going to ask you to take your pulse for a full minute or even just for 15 seconds. We want you to take it for a 10-second period. And one of the reasons around this is that when you do stop your exercise, your heart rate does within about 10 seconds can start to recover and come back to normal. We want to get a good snapshot of what your pulse is while you're doing the exercise. Your pulse can be taken in two areas in your body. Some of you may already be aware of this and have checked this already. The first is called your radial pulse, and that can be actually found in your wrist. And you can see on the slide here that it's taken with two fingers, not your thumb. It's taken with two fingers from one hand, and the hand that you're actually taking the pulse on, it's on the thumb side of the wrist. So to landmark, what you want to do is turn one hand up, let's say your right hand, and take two fingers of your left hand and follow along the thumb side of your wrist to the bone that's on the side of your wrist. What we're doing now is first landmarking to find your pulse. Once you find that bone on the edge of your wrist, slide your fingers just inside to that bone where you see on the slide here, and push your fingers into that area. And there's a little bit of a groove there you should be able to feel. And while you're palpating that particular area, you should start to feel a pulse, sort of a thump, thump, thump rhythm. It does take practice to landmark in that, and we will continue to help you to find that and landmark that pulse. What you're going to do is use your stopwatch to measure your pulse over a 10-second period. And we will be helping you on the track, and the staff will be helping you with this as well. If you're unable to find your pulse on your wrist, your radial pulse, there is another area of the body that you can check your pulse as well, and that's called a carotid pulse, and that pulse is found in your neck. That picture is indicated on the bottom of the slide, and it's just to the side of your Adam's apple in your neck, and you're going to press your fingers into the side of your neck, and you should feel the same thing, a thump, thump, thump type rhythm. Now, we don't want you to be pushing too hard into that particular area of your neck, because there is a mechanism there that regulates how much blood does go to your head. So if you're unable to find it there either, then we'll go back to working on trying to find it in your wrist. If these particular areas are still a challenge, because some people may have problems feeling in their fingers their pulse, then we will look at alternatives. And some alternatives may be accessing a heart rate monitor and purchasing one of those, where you would wear a strap around your chest and a wristwatch that actually transmits what your heart rate is to the wristwatch. And all you have to do is check your wristwatch, and it tells you what your pulse is. So we'll continue to work on that with you. The stopwatch that you purchased as part of your package here in the program is really used for two reasons. The first reason is to measure your time for your walk. So if your exercise prescription is 2 miles in 40 minutes, you're going to be measuring over that, walking that 2 miles, that you're coming in at that 40 minutes. So you may be coming in at 39 minutes and 55 seconds. We want to know that you came in at 39 minutes and 55 seconds. The numbers are nice and big on the watch, and you can see them clearly. To use it, it's 3 buttons on your stopwatch. The button on the right is your start and stop. The button in the middle is your mode. The mode switches you between a stopwatch mode and a time mode. I do suggest that you keep it in the stopwatch mode and not switch it. The button on the left is your reset button to take you back to 0. Again, we will help you to use the stopwatch. It takes a few tries to understand how to use it, and the staff will help you with that on the track. The stopwatch is also used to measure taking your pulse. So when you are finding your pulse, you can use these nice big numbers on the stopwatch to measure that 10 seconds that we talked about. The next thing we want to talk about are your exercise diaries. Your exercise diary, as we said before, is a key communication tool between your case manager and you, because we only see you once a week. As you can see that the diary are on colors, so your particular color may be red, it may be turquoise, it may be yellow, and you will continue to use the same color diary. The color allocates who your exercise supervisor is. We ask that your exercise diary be handed into reception each time you attend the center at the beginning of each class. So the first thing you want to do is check in at the front desk and hand in at reception or to our volunteer your exercise diary. We use this as a way to take attendance. As well, your exercise supervisor will be reviewing your diary and review the entire class's diary before you head out to the track to do your exercise. And we're able to determine if there are any problems or issues that we need to talk to you right away about. The exercise diary is a requirement to participate in the program, and if we don't receive them from you, we will be talking to you about it and asking you why it is, or if there may be a challenge for you with respect to filling out the diaries. And if there are some challenges around it, we certainly want to help you overcome those challenges, because it is a very important communication tool with us. So this is a sample of the exercise diary, as you can see. There's quite a bit of information on here, so we're going to go through how to fill out the diary. You can see that it's for 1 week, so every week you are going to be filling it out. There is our phone number at the top of the diary in case you have to call us to let us know any information, so you always have access to our particular telephone. At the top is a place for your name, your exercise prescription, as well as an opportunity for you to track your weight on a weekly basis as well. You just need to circle the day of the week that you're coming as well. So we're going to take an example and go through the exercise diary of, let's say, filling in 1 day's worth of your walking. So the first thing you're going to be filling in is, again, for example, your name at the top, and for this example, your exercise prescription may be walking 1 mile in 18 minutes. That particular week, John Doe is 145 pounds. So the first thing you're going to do, you can see in red there, is the date. So you're going to put the actual date that you actually walked. The next thing you're going to do is put the type of exercise that you're doing. And if you're doing walking as your prescription, just simply put walk. The next column over is your distance in miles. If you do think in kilometers, you can put that in kilometers as well, and we can do the math to see the difference. So I would put 1 mile. The next column over is duration, and we want to know, and this is where your stopwatch comes in handy, is how many minutes and actually how many seconds it took you to complete that 1 mile. So in this case, John Doe did his exercise prescription in 17 minutes and 58 seconds. And we do want to know the details of the seconds. A few seconds off can be the difference between one exercise prescription and another pace. We also want you to be taking your 10-second pulse count, and that's the next column over. Before you head out for your walk, before you do your warm-up, we want you to take your pre-exercise pulse. So before John went out, he took his pulse over a 10-second period, and he counted 11. He took his pulse at the end of his walk before he does his cool down, and he got his heart rate up to 18 beats over 10 seconds. Then he went on to do his cool down. So remember, just as a reminder to you, when you take your pulse, you want to take your pulse before you do any activity, so before you do your warm-up, and then you want to take your pulse before you do your cool down. Okay, before you bring that heart rate back down to resting levels, then you can do your cool down. The next column over is your rating of perceived exertion. And John Doe rated this as a 12. And if you take a look over to the right-hand side of the diary where it says RPE scale, you can see that this is a rating of perceived exertion scale that he's referring to. On every walk, we want to ask him, how much effort did you put into the walk? This particular scale goes between 6 and 20, and each number represents a statement. So between 6 or 7, that particular effort is very, very light. And that would maybe you sitting in a chair, relaxed, listening to this particular lecture. If you start walking at a pace that is a brisk pace for you, you may be rating it maybe a 12, 11, or a 12. So generally we want your exercise prescription and your RPE to be between 11 and 13, fairly light to somewhat hard. If you start to rate that rating of perceived exertion higher than a 14, then it's indicating to us that it's a little bit too difficult for you and we may need to readjust your exercise prescription. If you're rating it a 6 or a 7 or an 8, then it's telling us that it's too easy for you and we may need to readjust as well. It does take a little bit of time to get used to how to use this particular scale, but over time you will learn and know what a 11 fairly light effort means for you and what a 13 a somewhat hard means for you. If you have problems with this particular scale, talk to us about it and we'll be more than happy to go over that with you. The next column over is symptoms, remarks, other activities. So this is sort of a free space for you to talk to us about what happened on that particular exercise session. John Doe said that he felt good on this particular session. If you experience leg cramps, chest pain, then we want to know about that. We want you to write that in. Again, that's why this is an important communication tool for you. We want to know the good things as well. If the weather was great and you had a good walk, tell us about that as well. Tell us if it was a little hotter that day for you, and maybe that's why you came in a little bit slower that particular day. If you engaged in other activities that you've talked to us already about, you can put that in that area as well. At the bottom of the exercise diary, you'll see that there is a space for resistance training. At this particular moment, at the beginning of your program here at the Rehab Center, we don't want you to worry about the bottom of that diary. For now, we want you to disregard this portion, and we're going to be beginning that resistance training program in a couple of months, as I mentioned before. So at this particular point, disregard the bottom of that. On the right-hand side of the diary, you'll see that there's an area at the very bottom around talking about goals. Some of the questions that are there are with respect to what action did you take this week towards achieving your goal? What went well this week with relation to your goal? And what did not go as planned this week in relation to your goal? Once we start talking to you about your goals and what you want to be working on in the program, we're going to be using the exercise diary as a tool for you to tell us how things are going on a week-to-week basis. So you'll be able to start giving us some information, even if we're not able to sit down with you on that particular day and talk to you about it. If you flip over on the back of the diary, you'll see that there is other information there for you to fill out as well. The first section on the back of the diary is any hospital admission or outpatient visits to the emergency department, let's say. We need to know if you've been that week to the hospital, so please fill that information out. If you went to your physician's office for maybe a visit for some kind, for a checkup or for your physical, let us know about that. Any outpatient services like blood work or testing or a stress test that you may have went for, please tell us about that. And if there's been any medication changes that you've undergone that particular week, tell us about it. And in this example, you can see that this particular patient had a change in his metoprolol, his beta blocker medication, on a particular day, and indicated to us that his dosage decreased to 25 milligrams twice a day. So this information is very key to us because it may alter your exercise prescription and it may alter how you feel as well as what your heart rate response is with respect to your exercise. Now we want to move on to talking about a little bit about your training shoes and the importance of making sure you have proper footwear for your exercise. If any investment you have to make into your exercise, this would probably be the most important one, and getting the proper, what we call, running shoe. And this is the anatomy of a proper running shoe. Remember that when you do go out to getting a new shoe, that you want to ask for a running shoe, not particularly a walking shoe or a cross trainer or a tennis shoe, but a running shoe. Even though you may not be running, and it sounds a little bit odd, but the support that occurs in a running shoe is very effective for your walking program. First of all, you want to make sure that the heel of the shoe is very supportive and it gives you a lot of stability. And there's usually a lot of cushioning in the heel part of the shoe because that's where you're striking down on the heel when you're walking. You also want to make sure that there's proper fit in the upper portion of the shoe. And one of the important factors of a shoe is making sure that it has laces. Some people may have trouble with tying their laces or reaching down to their laces and putting on their shoes, so we will talk to you about some alternatives to that. But if at all chances you can get something with a lace, that is very important because it allows to stabilize your foot. The outsole of the running shoe gives you a lot of durability, gives you a lot of traction, and the running shoe is actually even used in the wintertime out in the cold weather. Even on some of the snow that's out there if you're doing exercise training outside. So make sure that you do stick with your running shoe in the cold weather and not putting on heavy boots. So traction and durability is very important. The material that's used in the shoe as well is important. In a running shoe, it dries easily and it breathes very well with some of the material that they use. What's nice about a running shoe as well is that it gives you adequate toe box room in the front of the shoe so that your toes aren't squished. And if you are living with diabetes, this is very important to try to decrease the amount of injury that happens to your toes. More information about looking at your case manager and your exercise leaders will probably be taking a look at your shoes and seeing whether you need an upgrade in them and giving you some tips on what you may be looking for as well. And just on to some general information about the program. When you're attending here onto the on-site program and parking, you know that we want to make sure that you're parking in the right area of the building. So please make sure when you're coming through the parking gates, you park in the back of the building behind those particular gates. Most of you have purchased a parking pass that's here in the program, and just make sure that you keep that parking pass with you, and at the end of your program you can actually bring your parking pass back to get a deposit, I think a $10 deposit on your parking pass. Headphones and cellular phones while you're here on the program. You are able to use some headphones on the track if you want to listen to your iPod or your Walkman. However, we do want to make sure that you are aware of your surroundings, and if staff need to speak to you while you're using your headphones, we do ask that you take them off so we can talk to you while you're here on the program. Cellular phones we try to avoid you using in the center and make sure that you turn them off before you enter the building. They might interfere with some equipment and can be a little distracting in some of the education lectures as well as on the track. Lockers and change rooms in our lobby of the building are available to you, and what we have in the locker area is lockers itself, and we ask that you bring your own lock and use it for a day. So it's not a place for you to keep your stuff here over the weeks that you're on the program. So bring a day lock, lock it up, and then empty out your locker and take your lock with you when you leave for that particular day. And showers and towels are also available in the locker area for you if you're running off to another appointment or back to work. Those are available for you. We just ask that you leave the towels back so that we can get them to the laundry. Name tags. Each of you have a name tag that's color-coded, and that name tag is yours for here for the duration of the program. So please make sure you bring it with you each week and wear it. We will get to know your face quite quickly and know who you are, but it is a requirement that we have your name, you wear your name tag while you're here on the program. If you do happen to forget it that particular day, when you check in at the front desk, ask the receptionist for a temporary name tag, and they will give you one when you check in. When you do come to the center, the first stop that you make to the center is into our reception and making sure you're handing in your exercise diary. We need to know who's in the building at all times, and we like to know to make sure for our paperwork that your attendance has been taken while you're on the program. And exercise diaries, as we talked about, is a requirement, and we ask that you hand that in when you come in as well. Mall maps. For those of you who want to do your exercise indoors in an air-conditioned or heated area, depending on the weather conditions, malls are a wonderful venue to do your exercise prescription. And we do have all the mall maps in the GTA area for the major malls that do offer these particular programs in our lobby. And you'll see in red folders in the lobby on the wall that there are various maps for the malls in the city And if you take a look at the map at the end, it will tell you a route around the particular mall to indicate what the distance is and how long it will take you to go around to do a certain mileage on there. Mall walk programs are great. There's some particular mall walk programs that have groups that you can register with, that you can walk with a buddy with. Some can be very individual. You just go at a certain time during the mall opening hours and to complete your exercise. So please take advantage of that. Visitors or interpreters to the program that come here with you. If you have a visitor that comes with you, that's great. We encourage that. We do ask that family members and visitors stay in the lobby during your exercise here when you're here up on the track. If you needed the particular family member as an interpreter for language issues, then they can come with you onto the track. But we do ask that they wear a visitor's name tag while they're here on the program so that we know who they are and who's on the track. We do welcome any suggestions or any concerns that you have, that you've noticed about the program, that you think might work better, that you have a problem with. Please let us know about it. There is a suggestion box in our lobby, and we ask you just can anonymously write that, or you can give it to your case manager and let us know about it, and we'll make sure that it gets to the proper people who make certain decisions in the program. And that brings us to the end of your orientation session today. Hopefully you've got sort of the nuts and bolts of the program and understand how the program works. You will be again meeting the rest of your team over the next sessions, and I wish you good luck in your rehabilitation program. Thank you.